Doc, Shedding the Curtain for Privacy. Hi, good afternoon, Danielle. My name is Amanda, and I'll be your student nurse today. I'll be doing a physical exam on you. Okay, Danielle, if you can just tell me your name and date of birth, please.
Danielle Carpenter, 6/21/92.
Okay, perfect. Would you please tell me today's date?
November 13th, 2015.
And would you tell me where you are?
St. Francis Hospital.
And do you know why you're here?
For physical examination.
Okay. Danielle is awake, alert, and oriented ×4 to person, place, time, and situation, and appears to be in no acute distress. Her behavior is calm and cooperative. Her skin is pink with no signs of cyanosis. Danielle is well nourished and well developed. Her position and posture are comfortably erect. She exhibits no signs of deformities. And if you could get down, if you could have a seat, swing your legs to the bed, I am going to ask you to walk across the room to assess your gait. Her bed is in low position, so if you can just walk for me, please. Danielle's gait is regular with no involuntary movements. All right, if you can just walk back here, we're going to do some range of motion exercises. I'm going to do them with you, so if you can just follow along with me, okay? All right, we want you to bend down, I'm not going to do this one, and touch your toes. And I'm going to assess her spine at this one open. So we're going to act like this opened. Okay. Spine curvature is normal. Okay, Danielle, now if you can get up and if you can lean backwards, we're going to hyperextend the spine. Perfect. Okay. Now if you can just follow these exercises with me, we're going to rotate the neck. We're going to do protraction if you can stick your neck out, and retraction. Perfect. Flexion and extension, and hyperextend the neck. And we're also going to do circumduction, which is circling of the arms. Okay. We're going to abduction with the hands, the arms, and adduction back at your shoulders. If you can elevate, we're going to do elevation and depression. Perfect. Okay, if I can just have you sit in the bed, we're going to do range of motion of your lower extremities. Okay, so we're going to do hip. We're going to lift the bed so we have no back injuries. So we're going to do range of motion of the lower extremities. We're going to do hip flexion, so if you can just lift up your leg to close to a 90-degree angle as far as you can. All right, and then we're going to extension, the hip extension. Then we're going to do internal rotation of the knee and external rotation of the knee, as well as abduction of the leg and adduction of the leg. Okay, if I can have you point your toes, which is plantar flexion, and lift up, which is dorsiflexion. Yep. Okay, so if you can just point your toes in, it's going to be inversion, and out, which is eversion. Her facial expression is appropriate for the situation, and she maintains well eye contact and seems calm, cooperative, and comfortable. Danielle appears to have no range of motion difficulties. When speaking with Danielle, her articulation is clear and understandable. She speaks fluent English with an even pace. Danielle hears questions with no difficulty and responds appropriately. She is well groomed and clean. Okay, now I'm going to assess your hands and nails. If you can hold out your hands for me, please. Okay. Her hands are and fingers are well formed with intact nail beds in each. On each finger. Hands are smooth, warm, and dry to touch. There is no clubbing or deformities present. Nail beds are pink and capillary refill is less than 2 seconds. Her skin is pink and appropriate for her race. Alright, so I'm washing my hands and I'm going to put some gloves on and we're going to assess the rest of your skin. Her skin turgor is appropriate and there's no signs of dehydration. Now I'm going to assess the rest of your skin for any skin breakdown or any abnormalities, okay? So I am just going to look at all bony prominences just to make sure. Okay, and some lotion. Just kidding. You can bend your leg. And I would check the other side as well. Danielle's skin appears intact with no evidence of lesions or skin breakdown and is dry to touch. Danielle, now I'm going to inspect and palpate your scalp, okay? We're inspecting for any lumps or lesions. Do you feel any tenderness or pain? No. Okay, perfect. Danielle's head is normocephalic and there is no lumps present, no lumps or lesions present, and she denies any pain or tenderness. Her scalp is intact and her hair texture is fine with even distribution appropriate for her age. Okay, Danielle, now I'm going to assess your cranial nerve number 7, which is your facial nerve. If I can have you smile for me, frown. If you can close your eyes tightly, open them. And now raise your eyebrows. Perfect. If you can show your teeth, and if you can puff your cheeks. Perfect. Her face is symmetric with no signs of weakness or involuntary movements. Okay, now I'm going to palpate your sinuses, okay? Do you feel any pain or tenderness? Okay. Danielle denies any pain or tenderness when palpating the sinuses. Okay, Danielle, now we're going to assess cranial nerve number 2, which is optic, by doing the confrontation test. So if you can just cover one of your eyes, the same side as me, and just let me know when you can see the pen. Okay, and now we're gonna do the other eye. Can you see the pen?
Yeah.
Okay. Danielle's visual field is intact by the confrontation test. Now I'm going to assess cranial nerves number 3, 4, and 6, which is oculomotor, trochlear, and abducens, by the 6 positions of gaze. So if you can just, without moving your head, follow my pen light. All of Danielle's extraocular muscles are intact by the 6 cardinal positions of gaze test. Okay. Now I'm going to inspect her external eye. We're looking at the eyelashes as well as the eyebrows. They all seem to be intact and symmetrical. Now we're going to assess her internal eye. Okay, her conjunctiva is clear and sclera is white. Now we're going to do the pupillary response test. So if you can just look straight ahead, okay? I'm going to shine a light and just watch her pupils constrict. And her pupil size before is about a 3. And we're now going to do the consensual light reflex. Shine it straight at her nose and watch both pupils constrict simultaneously. Pupils are equal, round, and reactive to light and accommodation. Okay, now I'm going to assess your ears, okay? We're going to check the external ear and around the ear. Do you feel any tenderness or pain? Okay. Okay, and we're going to do the other. And do you feel any tenderness or pain? Okay. No masses or lesions are present on Danielle's ear. And at this time, I would use an otoscope to look at the tympanic membrane, make sure it's intact and a silvery pearl color. As well as with the eyes, I would have used an ophthalmoscope that we do not have right now to look at the retina, the optic disc, as well as the internal eye vessels. Danielle denies any pain or tenderness when palpating the ear. Okay, Danielle, now we're going to assess cranial nerve number 8, which is vestibulocochlear. And we're going to check your hearing, okay? So what you want to do is push on the tragus, make sure it's closed to occlude all hearing, and then you want to stand back and this is called the whisper test. So if you can just repeat the words after me, okay?
Soccer, Thursday, baseball.
Okay, perfect. Danielle is able to hear words stated and there is no hearing impairment. And at this time, I would assess her other ear as well to make sure the hearing is bilaterally the same. Okay, Danielle, now we're going to assess the nose. We're looking for symmetry and Danielle's nose appears intact and symmetrical. Okay, we're going to close one nostril and if you can just breathe for me. Okay, and the other one as well. Now we're going to look up the nostril. Okay, and her nares are patent and intact. Okay, Danielle, now we're going to assess your lips and mouth, okay? So if you can just open. Okay, her mucous membranes are pink, moist, and intact. I'm going to get my tongue depressor. Okay, if you can open your mouth. Oh, I'm taking your pupil. And if you can touch your tongue to the top of your mouth. Okay. And if you, now we're going to assess cranial nerve number 9, which is the glossopharyngeal nerve. If you can stick out your tongue and say ah. Okay. Her tonsil grade is a 2+, and they are visible. Danielle's uvula rises midline, and now I'm going to assess cranial nerve number 10, which is the vagus nerve, by doing the gag reflex. Okay. Okay. And now I'm going to assess cranial nerve number 12. If you can just stick out your tongue. Okay. And her hypoglossal nerve is intact, and her tongue protrudes to the midline, and there's no sticking to one side. Okay, Danielle, now we're going to inspect your neck, okay? So we're looking for the trachea, and the trachea is midline. We're going to palpate the cervical lymph nodes, which they're non-palpable, which means they're not inflamed. And is there any tenderness or pain when palpating? No. Okay, she denies any tenderness or pain when palpating the cervical lymph nodes. There's no masses or lesions present. Her skin is warm, dry, pink, and smooth to touch. Now we're going to palpate the carotid pulse. Her pulse is 2+, which is normal. And no bruits are present. Okay, Danielle, now I'm going to assess your neck for any jugular vein distension. What we want to do for this is lift the head of the bed to 30 degrees. And if I can have you turn your neck. And we're going to shine a light to the side of the neck. And there seems to be no jugular vein distension present. I'm going to assess cranial nerve 11, which is spinal accessory. If you can please put your chin to your chest and go turn left and right. And if you can shrug your shoulders. Okay. Cranial nerve 11 is intact, has full range of motion. Okay, Danielle, now I'm going to inspect your arms. Okay, her upper extremities are symmetrical. Her arms are pink, dry, warm, and skin is intact. Now if you can bend your arms for me, we're gonna check your muscles, and then now if you can push my hands away. Okay, perfect. She has full range of motion with no upper extremity weakness. Danielle, now we're going to, I'm going to palpate your radial pulse and also your brachial, okay? So as I'm doing this, I would, in a clinical setting, do this for 1 minute for each, okay? But her pulses seem to be 2+, and I also would do the other side as well. Okay, Danielle, now I'm going to assess your chest and lungs. If I could have you stand up, please. And normally I would do this with bare skin. So skin is pink, dry, and warm to touch. If I can have you turn around, and with your fingers like this, you're going to go under and take in a deep breath. Okay. And chest expansion is symmetrical. Okay, and again, we would also have a bare back. So what we're going to do is just palpate. And do you feel any pain or tenderness? Okay, and then if I can have you bend a little bit, I'm just going to palpate your spine. Also, this would be bare. Okay. Her spine's process is in line and there's no deformities. Okay, Danielle, now we're going to do the costovertebral angle tenderness test. And this is testing if the patient experiences any pain during the palpation. That means the kidney is inflamed. So you want to go to the 12th intercostal. And does this cause you any pain or tenderness? No. Okay, so patient denies costovertebral angle tenderness. I'm going to assess your lung sounds, okay? And normally I would do this bare skin. All right, you don't want to listen over any bony prominences. You can take a deep breath in. Okay, her breath sounds are equal bilaterally and there's no rails or rhonchi present. Okay, Danielle, now we're going to assess the heart. We're going to inspect the precordium area, which is where the apex is. So we would put 4 fingers over. Normally this would also be bare skin. There's no visible pulsations. Okay, and now I'm going to check the apical pulse, which is the midclavicular line, the 4th or 5th intercostal. This would be bare skin. Danielle's apical pulse is 78 and her rhythm is regular. Now we're going to also take the sounds of the valve areas, okay? Okay, now I'm listening to the aortic valve, which is at the second right intercostal. The pulmonic valve, which is at the left second intercostal. Now I'm listening at Erb's point, which is the left third intercostal area. Now I'm listening to the tricuspid valve, which is the left lower sternal border. And we're listening to the mitral valve, which is the fifth intercostal, left to the midclavicular line. Okay, there is no adventitious sounds. She has no murmurs or bruits present. We're going to listen for S1 at the apex and S2 at the base, because that's where it's best heard. Okay, Danielle, now we're going to assess your abdomen. Again, we would do this bare skin. If I can just, okay, her skin is pink, warm and dry to touch. Skin seems to be intact. Her abdomen is slightly rounded. We're going to listen to your bowel sounds, okay? And we will start in the right lower quadrant because that's where most bowel sounds are present. Okay, bowel sounds are present in all four quadrants. If there was an absence of bowel sounds, we would listen for 5 minutes. Okay, now we're going to palpate the femoral pulse. Okay, and the femoral pulse is a +2, and I would also do the other side. Now we're going to do a popliteal pulse, so if you can bend your knee. This would also be bare skin as well. Okay. Okay, popliteal pulse is 2+, and I would also do the other side as well. We're going to palpate the inguinal nodes, and they are non-palpable, which is good, shows no inflammation. And did you feel any tenderness or pain? No tenderness or pain present when palpating the inguinal nodes. When I observed Danielle's abdomen, there was no masses, lesions, or bulges present. Her contour was symmetrical and slightly rounded, and there was no visible pulsations around the umbilicus area. Now we're going to do test for a Holman sign. So if you can, this is testing for any deep vein thrombosis. So you want to hold the leg up, you don't want to let it rest on anything, and you want to dorsiflex the foot. Do you feel any pain or tenderness?
No.
Okay, and if there was pain or tenderness felt, that would be a sign of DVT. Okay, Danielle, now we're going to assess your pedal pulses. So we're going to do the posterior tibial and also the dorsalis pedis. Okay, and pulses are 2+, and I would also do the other foot as well. To do the Babinski reflex, okay, and you want to curl and a normal sign would be the toes flexing. If they extended or fanned out, that would be a positive Babinski reflex. Okay, there is no pitting edema in her ankles. Her skin is pink, warm, and dry to touch. All skin is intact. We are going to check for muscle strength. So what you want to do is push, and then if you could push like a gas pedal. Okay, perfect. There is no signs of weakness bilaterally. Okay. And then we're also going to do capillary refill. Capillary refill is less than 2 seconds. Okay, Danielle, now I'm going to test sensations of your face. If you can just close your eyes for me. And just let me know if it's pointy or sharp or soft. Okay. She is able to feel all sensations of the face. Now that we assess the sensations of the face, we're also going to do the arms, legs, and feet as well. Okay, so if you can just close your eyes, and then when I touch you, if you can just let me know the type of sensation you feel. Okay?
Sure. Sure.
Alright, and then we'll do one of your legs. And anything that we do to one side, we would
Sure.
do to the other as well.
Soft.
Okay, and then feet.
Sure.
Okay, so she feels all sensations. Right now we're going to do a little mini mental exam to assess her memory. In the beginning I did assess level of consciousness and we asked time, place, situation, person. Now if you can just remember these 3 words, ball, cat, red. And then I'm going to show you 2 objects and if you can name these objects.
Watermelon.
Okay. Now if you can please say back the 3 words to me.
Ball, cat, red.
Okay. Good. She is able to pass the mini mental assessment, and memory seems to be intact. Okay, Danielle, now we're going to assess your tandem walking, which is a heel to toe walk. So if you can stand up and walk heel to toe. Okay, and now you can turn around and walk heel to toe back. Okay, and if you can just turn around, her gait is steady, and tandem walk is fine. We're also going to assess your Romberg, so if you can just close your eyes and feet together and hands at your side, and we're going to count for 20 seconds and there should be minimal swaying. Okay, Romberg test is negative. Okay, Danielle, now we're going to do some range of motion of the spine. Earlier we did do a toe touch, so that's fine. If you can just twist at your hips. Okay, and then if we're going to do a shallow knee bend, so stand and then bend down on one knee. Okay, she has full range of motion with no weakness, and this now concludes my physical assessment video. Thank you for your time. All of the tests that I performed on Danielle would also, on the one side, would also be performed on the other side as well.